Hey guys, this is Manu, Kalia, physical therapist and herbalist. So I'm going to show you another technique to stretch your hip flexors as well as your quadriceps. And on the opposite side, at the same time, we're going to stretch our hamstrings. So it's a pretty good technique, especially for those of you who have a hard time standing or kneeling to do stretches for these tissues. I'm going to be stretching my right hip flexor as well as my right quadricep, and I'm going to work at opening up the front of the right hip. And then on the opposite side, my left side, I'm going to stretch my left hamstrings, okay? As well as get my calf too. So edge of the bed, I'm going to start by pulling my left knee towards my chest. This also to help protect my spine. And I'm going to gently drop my right leg down off of the edge of the bed. Now, this keeps my low back in a good position, neutral position, and it protects it. Now, I can increase the stretch on this tissue by how far I pull my knee towards my chest, or how far I straighten out my knee on this side, right? So the further I go this way, the more pull I'm going to get on my hamstring. That's why hip flexors on the opposite side too. And if I bend my knee on my right side, that's another way to get not only my quadriceps, but also to get better mobility of these tissues on my right side. So I have multiple levers to control how much of a pull I want, how strong of a pull I want on these various tissues. Okay, so let's say I'm going to bend my knee here. I'm going to get myself set in this position. Now I'm getting some stretching here. And then I'm going to work at straightening out my knee on this side. Now if I pull my knee towards my chest here, while I have extended somewhat, I get to also work at stretching my hamstrings, as well as working at stretching my hip flexors on my right side and my quadriceps too. And again, as I mentioned, I have multiple levers to control here. So if I want a stronger pull on all these posterior structures, I can bring my foot towards me. Right, now I'm getting a stretch to my calf too, as well as my hamstring, depending on how far I pull. Right, so I can control that by, if I want to put a little slack in it, I point my foot away from me. Right, I can even bend my knee a little bit. That'll put a little more slack in this tissue, so I don't have as strong a stretch in my hamstring. Okay, and on my hip flexors, the same thing. So if I go further towards me, and let's say I don't want to get the hamstring as much, but I just want to get some more mobility in my hip flexors. So I pull this towards me and I let this hang down. Now I'm going to get more mobility through my hip flexors here and my quadriceps there. Okay, so as you can see, you can control this stretching with multiple levers. Okay, multiple tissues. And keep in mind that for those of you who have low back issues and some nerve tension, you have to be extra careful with this, especially on this side, because when I straighten out this leg, and especially when I point my foot towards me, I'm really tensioning, not only stretching the soft tissue and the muscles, but also tensioning that nerve, that sciatic nerve. So you have to be extra careful when I'm bringing my foot back and forth, and I'm almost doing a neural flossing technique. Okay, just be careful of that, and make sure you don't crank on it. Take your time, work at that, and make sure you do both sides, so this way you can compare and see how one side compares to the other. If you have any questions, leave a comment, and make sure you check out the site. Have lots of info on it. Thanks, guys.